Dear colleagues, dear friends, Assalamu alaikum. Before to start, I want to thank the Saudi Orthodontics Society for the invitation and the organizers, also all the organizers, especially my friends, Dr. Muhammad Al-Harbi and my friend Dr. Reem Al-Ansari for their invitation. This is the second time with Saudi Orthodontic Society, and it is for me an honor and a pleasure to participate with you in this prestigious society. Today I will talk about the key element to improve the smile aesthetic with orthodontics, with our specialty. And before to start the technical part of my presentation, I would like to define some keywords. The two keywords we must define are aesthetic and smile. Let's start with aesthetic. What we mean with aesthetic when we want to reach, for example, an objective related to aesthetic. Aesthetic can mean beauty. And if you ask someone what is beauty, it will, for general people or even for professionals, it will be difficult to define it with precision. We must, if we want to reach a good result, an aesthetic result, we must define this word. And this word has three components. The first component is the temporal component. Aesthetics change from one period to another period. So we must be aware about our period. What is aesthetic for the people today? Aesthetic of today is not similar to the aesthetic 15 years or 15 years ago. So we must try to change our concept regularly to be aware about the trend and what people want to reach. And the second component of this word, beauty, is a cultural component, and this is important also to take in consideration, especially in the area where we have a lot of ethnic groups. We cannot, for example, treat a big protrusion in the same way in a Caucasian face or in sub-Saharan face. For example, for sub-Saharan face, we can tolerate a big protrusion, and we cannot, for example, in our ethnics, we cannot tolerate a big protrusion. A patient don't want it, so we must correct it. So this cultural component is important. The third component is the perceptual component, and this component is related to psychology of the patients. And these components change from one patient to another patient. So we must also take in consideration even if we have standards, we must take in consideration the demand of the patient. The second meaning of aesthetic is the art to design the beauty. And our specialty is one of the specialties that contribute to improve the smile aesthetic and the aesthetic of the face. So we must not consider our aesthetic results related only with the aligning the teeth, but we must have some references, some standards to reach reproducible result in every place. So, what is our daily practice? In our daily practice, we try to reach an aesthetic result. And what is aesthetic result for the patient? Maybe aligning the teeth. But if we want to have more than that, we must not consider only aligning the teeth as an objective. We must try to change or to reach other objectives, not only the aligning teeth. For young patients, for adult patients, for example, for the patient, this patient came to my office to align only the 12th, the right lateral incisor. We can align only these teeth, the right lateral incisor, but it is not. If you want to reach an aesthetic result, you must look for more than that, to have an impact not only on the teeth but on the face. And even for the third age patients, we can also reach a good result, not only by aligning teeth, but doing more than that. This is what we will see step by step during this presentation. The third meaning of aesthetic is a science. When we talk about aesthetic, we can mean that is a science of perception of the beauty. So unfortunately, these aspects are not taught in the universities because we are not well educated in this aspect, the psychological aspect of our, and this is important for all people who do aesthetic dentistry with veneers, with crowns, or even with orthodontics. Every time we must have some knowledge and some competency to satisfy our patients. So this science must be taught and must be taken in consideration in our daily practice. The second word we must define is the smile. What we mean with the smile? Is it the smile only when the lip moves and when we discover the teeth, or it can be another type of, we can have another type of smile? We have two types of smiles. Smiles where the teeth are discovered, and also the smile where the teeth are not discovered. And the role of the orthodontist is to improve these two types of smiles, not only these smiles that discover the teeth, because we can also move the jaws, and by moving the jaws, we can move in also the smile that not discover the teeth. So, what is the role of the orthodontist? The orthodontist can have four roles. He can move the teeth, he can move the gingival margin, he can move indirectly the lips, and he can move with some tools the jaws, or with the help of orthodontic surgery, he can improve the position of the jaws. So let's start with the role of, or the impact of moving the teeth on the smile. When we move the teeth, when we align the teeth, we have a first impact on the smile. But as I said previously, this is not sufficient objective. We must take in consideration other objectives. We must align the teeth, we must correct the occlusion, because the occlusion has, and we will see it in detail later, the occlusion has an impact on the stability, but also on the aesthetic. But we must take in consideration also not only anterior teeth, but also posterior teeth. The posterior teeth, when we align correctly, when we position the lateral teeth in the right position, we can have a more aesthetic result, or a beautiful result, an aesthetic smile result. So we must take in consideration the aligning the anterior teeth, the occlusion, but also the position of the lateral teeth. The second role of the orthodontist is to move the gingival margin, and as you know, when we move the teeth, at least vertically, we can move the gingival margin. So, for example, in this case, we have the gingival margin of the lateral in the wrong position, and this is an inesthetic. This small detail can have an impact on the smile aesthetic. we know that the gingival margin of the laters must be below the gingival margin of the canine and the gingival margin of the central. So we must, when we put our brackets or at the end of the treatment, on the middle of the treatment, we must reposition our bracket to have a good position of the gingival margin. Like in this case, we moved the gingival margin of two laterals to improve the position, to improve the aesthetic of the smile. The role of the orthodontist is to move the lips also. Indirectly, by moving the teeth, we know that every time we move the teeth, we have an impact on the position on the lips. Like in this patient, she has a B protrusion of the lips. It is indicated to move the anterior teeth backward to improve her profile. And every time we improve the profile of the patient, we can improve the frontal result, which is the aesthetic of the smile. For young patients also, every time we have a big protrusion of the lips, we can improve the position or sagittal position of the lips, and this had a great impact on the frontal result. And like in this patient, the correction of the position of the anterior teeth had a great impact on the smile aesthetic. And the third role of the orthodontist is to reposition the jaws. We can reposition the jaws with our tools in growth patients, but in adult patients we need to have a help of the surgery, of the orthognathic surgery. And like for this patient, she has an asymmetry, she's in class 3. When we examine the occlusion, it's not a bad occlusion, and we can, with our tool, compensate the case. But we will never have a good aesthetic result, and we will not reach the demand of the patient. The demand of the patient is to improve the smile, to improve her facial aesthetic. So this can be reached with orthognathic surgery. And the smile aesthetic, this action on the jaws has an impact on the smile, on the aesthetic of the smile. Let's see now the smile components. If we want to improve our result, we must take in consideration 5 components: psychological component, skeletal component, lip component, gingival component, and dental component. Let's start with the psychological component. Every time we want to assess the psychology of our patient, we must ask ourselves, is the beauty is on the result of what we will reach or in the mind of the patient? So we must, every time, we must do a psychological diagnostic of the patient, and we must define clearly the demand of our patient. Example, this patient came to my office to improve her facial aesthetic. So it's a surgical case. She had a classical malocclusion. We treated her with orthodontics with the help with surgery. So we prepared the teeth, we corrected the occlusion, in this case with extractions. And at the end, we reached this result. And if you ask the professionals or even general people, if you ask them if it is a good result, I think the people will say it's a good result. But the patient was not satisfied. I want to be honest with you. The patient was not satisfied, but because you can notice that the chin is still on lateral position after surgery, and the patient was not satisfied even if she smiled on the photo. So we must define the real demand and the real what patient ask us must be defined very well. So the marriage can be this marriage view or the marriage objective can be asked by our patient, but it can also be in the mind of the orthodontist. Why? Another example, this patient came to my office to align her teeth. She was not affected by her facial aesthetic. And as a professional, I noticed that she has a bad position of the bad position of the chin. And she has an asymmetrical face and she needs surgery. I treated her with orthodontics and patient was really very satisfied. Even if she is still, she still has an asymmetrical face. So we must also be aware with our also objectives. We must answer the demand of our patient, not more. The second important element on this psychological component is the dilemma we have between the standards and the cultural background of our patient. So we must have always a standard as a reference, but we must take in consideration the cultural demand or cultural background of our patient. The second component is skeletal components. You are agree with me, we cannot improve the smile if the position of the jaw are not good. We have three situations. We have the situation where we have no skeletal problem, and in these cases the face express beauty, attractiveness, and balance. We must be aware in this situation, because if the face is, if the patient has a beautiful face, a balanced face, we must be aware not to look for more than what patient wants. These three patients are surgical patients. The topic of the day is not surgery, but technically these patients are surgical cases. If we want to do surgery in this patient, we must be aware that these patients are the most difficult patient for surgery. Why? Because they have a balanced face. If we are not obliged to do surgery in these cases, we must avoid surgery. We can, for this full class and big class skeletal class 2, only by moving things, only by compensating the class 2, we could improve clearly the facial aesthetic, only by moving the teeth. But in some situation, even if we have a balanced face, we must do surgery, like in this case, we have a cant, we have a vertical asymmetry, and we could not treat her only with orthodontic. Yes, we can use mini screws, but it takes a long time to correct the cant of the occlusion. So I prefer in this case to do surgery. But we must do a minimum surgery, not a correction of all dimension of the face. The second situation is the majority of situation we can receive in our clinic. The majority of our face are not symmetrical. We have always a small asymmetry, and even if we have a small asymmetry, we may take in consideration that these situations are, in the majority of the case, attractive, and it express a more natural situation, and even it can express mystery. Like in this case, this patient came to my office, and when I saw this face, I automatically asked the patient I told the patient that we cannot correct her smile only with orthodontics. She refused, but because she was not affected by her facial aesthetic. And in this case, the class 3 is really very big, and I was really afraid to not reach a good result compensating the case. So because she refused the surgery, I treated her only with orthodontics, and at the end we corrected the occlusion. Not only the occlusion, but the impact of this small movement on the facial aesthetic is very important. So all the class 3, all the surgical class 3 are not a surgical class 3. We can compensate a majority of class 3 surgical cases. And the third situation is the situation where we cannot do only orthodontic. In general, we have a big skeletal problem, and this skeletal problem affects a lot facial aesthetic because it's eye-catching, because it's not natural, and also because these situations are not aesthetic. This is a clear situation that can express what we are explaining now. This patient had a previous orthodontic treatment, 4-year orthodontic treatment, and she came to my office to improve her smile only with orthodontic. And I refused to do only orthodontic because she has a big skeletal problem. I told previously that we can correct with mini screws this type of malocclusion or this type of facial anesthetic face, but it takes a lot of time. In this situation, in my case, I prefer to use surgery, the help of the surgery. So, for this patient, she accepted the surgery, and what we did is to align the teeth and send her to the surgeon to correct her smile, and the smile at the end is really, really very beautiful. Can we compensate a big skeletal problem? Yes, we can. We can, not on all cases, especially on sagittal skeletal problem. When we have crowding, a lot of crowding, it helps the compensation. And in this case, the patient refused to do surgery. The mother of the patient refused to do surgery for her son. So I told her that I cannot reach a good result. That if she wants to avoid surgery, she must accept a compromised result. And this is what we did. We compensated the case only by moving the teeth forward, the upper teeth forward, and the occlusion is not very good, but I think it's a compromised result that can improve the smile, that can improve the position of the lips, and also that can improve the position of the lips. This situation, we cannot really choose this option in all the cases. This is really a limit case, but as I said, we have a favorable environment because we had a lot of crowding, and when we have the crowding, we can easily compensate the cases. Sometimes patients don't want surgery, and we cannot avoid surgery because the result will not be stable. This patient came to my office only to correct her open bite. The smile is really very beautiful. It's a correct smile. But to reach this stable occlusion, we, in this case, must do surgery. Why? Because this patient is a hyperdervision patient, and as you know that these cases are not stable if we compensate it. So what we did is orthodontic preparation with surgery, and this is has not only an impact on the face, but also on the smile of the aesthetic of the smile. Sometimes we cannot compensate the case and the patient don't want surgery. What we can do, for example, mainly in class 2, because in general, the class 3, we don't have a problem to convince them to do surgery. But the class 2 is different. So in the case of the class 2, we can limit the objective to 50% or 70%. In this case, she has really a big class 2, and in this situation, because the patient don't want surgery, we can only reduce the gap between upper and the lower incisor using some special tools, using stripping. And in this case, look at the full class 2 of the patient, and the patient asked me to reduce only the distance between the lower incisor and the upper incisor. At the end of the treatment, we could not reach full class 1, and what we reached is 50% of the result. So the gap or the distance between the upper and the lower incisor is reduced. We don't have a full class 1, it's clear, but this is a compromise solution or compromise result that can have an impact on the facial aesthetic of the patient, and also on the smile aesthetic. And really, in these cases, only by moving a little the teeth, we can have a good satisfaction of our patients. Sometimes we can improve the smile aesthetic by compensating the surgical cases, but we must, because the result will not be stable, we must tell the patient that they will have a permanent retention they must put the permanent retention every night if they want to stabilize the result. This patient refuses surgery, and as you know, we can compensate easily the sagittal dimension, the vertical dimension, but the transverse dimension in adult patient, the transverse dimension is not stable. So in this case, we can compensate the case, but the patient must be aware that he must wear the permanent retention if he wants to stabilize the result. We could improve the smile. We have before and after, but as I said, this is not a stable result. Sometimes we have a vertical skeletal problem. For these patients, in general, they have a gummy smile, an anesthetic smile. So if the patient don't want surgery, we have an alternative to avoid it by using some special tools like mini screws. It is not an easy way to correct the aesthetic smile in this case with these tools, but I think it's an option that we can offer to the patient to improve their smile aesthetic. This patient had a previous orthodontic treatment, and the previous orthodontic treatment, the doctor didn't correctly the torque of the upper incisor. But this is not the real problem. The real problem is the gummy smile. And for these patients, for example, in this case, we must, yes, correct the torque of the upper incisor, but to correct the gummy smile, we can use four mini screws at the upper jaw to move the teeth and to reduce the gummy smile. Look at before and after. This is an effective way to correct and to do an impaction of all the teeth. This is a special protocol to correct this malocclusion and this anesthetic problem. And you have here before and after the result of this treatment. At the end of the treatment, we must also always do a gingivectomy to improve, also reduce the gingiva and to improve the smile aesthetic. This is the final result. Before and after, we corrected the torque of the incisor, and we could improve the smile of the patient. The smile of the patient was really very sad. This is an option we can offer to the patient that don't want surgery if we want to improve the aesthetic of the smile. The third component of the smile, the lip component, we talked about previously about this point. Every time we said that we move the teeth backward for labial protrusion, we have an impact on the aesthetic of the face, and especially on frontal view. We improve the smile aesthetic every time we move backward the teeth, the anterior teeth. We can also improve the distance between the commissures, between left and right commissures of the labial commissures, and this is affected also the smile aesthetic. It is not only the aligning teeth, as we said previously, but repositioning the teeth on the right position, the anterior and the lateral teeth, to improve the smile, the aesthetic of the smile on frontal view and also on the profile. We have a problem with the relation between the jaws and the lip, the movement of the lip and the dimension of the lower dimension of the face. And this is a problem that we cannot resolve or find a solution only with orthodontics. We need to have or to ask the help of other specialties like surgery. And in this case, we can have different faces. The third component or fourth component is the gingival component. The gingival component we must take in consideration many elements. The first point we must take in consideration is the health of the gingiva. We cannot evaluate the impact of the gingiva if we have a not healthy gingiva. We must ask the patient before assessing the impact of the gingiva on aesthetic of the smile. We must have a healthy gingiva. The second important point is the embrasure. Every time we have a black point between teeth, we must reduce them, and you know how we can reduce them by reducing a little bit the enamel between the teeth by doing stripping in anterior teeth, but also in the lateral teeth. Gingival contours is important. Also, we can align the teeth. We can put the gingival margin in the right position. But if we don't have a good harmony, a good shape of the gingival margin, this problem affects the aesthetic results. So we must use in general lasers to improve the shape of gingival margin. And the aid, we talked about the aid of gingiva, the position of the gingival margin. Always we must put the lateral below the canine and below the centrals. The last component is dental component. This is also an important component to take in consideration if we want to improve the smile or the aesthetic of the smile. First of all, the dental axis of the interior teeth must be divergent. As you know, the aesthetic bands we put in our arches create a position, a diverged position of the anterior root of the teeth. So we must take in consideration this element as an important element in our daily practice. And dental axis, it's also the torque. Every time we need to correct the torque, we must correct the torque very well of the anterior teeth if we want to have a good result at the end. This is a patient with class 2-2. The impact on her smile aesthetic when we correct the torque is very important. One important point I want to talk about is B protrusion in adult patients. In adult patients, the B protrusion is not the same like in young patients. This is an experience I had with these two patients. These two patients came to my office after a previous orthodontic treatment, and they asked me to do another treatment to correct the B protrusion of the teeth. So my strategy is to extract 4 premolars. The two patients refused to do extraction. So what I decide to do is to improve the position of the teeth only by doing some stripping. And this is what we did. This is the occlusion before the treatment. 2 cases are in B protrusion, and this is the radio of the 2 patients before the treatment, and this is the result after the treatment. If we compare before and after, you will notice that we don't have a lot of change. But even if the patient are still in B protrusion, dental B protrusion, the 2 patients were really very satisfied. So the correction of B protrusion must not be corrected always by extraction, especially for adult patients. This is the final result, and the 2 patients was really very satisfied. One important element, the impact of lateral occlusion on the smile. Look at this patient. Before and after, we improved the smile, it's clear. But this is the arches, well aligned, okay. Look at the occlusion. I corrected the occlusion, the small class 2, and didn't correct very well the class. I still had, at the end of the treatment, a small class 2, and this small class 2 has an impact on the smile aesthetic. Why? Look at the canine, the torque of the canine. The torque of the canine must be corrected more labially if we want to have a good smile aesthetic on frontal view. This is an important detail. We must take in consideration the lateral occlusion and the impact of the lateral occlusion on the smile aesthetic. Look at the smile of this patient. This patient came to my office 2 months after the end of the treatment, and her father asked me why the lateral are a little bit not aligned with the canine. And you know why? Because the torque of the canine is not very well correct. Another important point related to the teeth is the dental contact. We must not leave spaces between the teeth if we want to have a good aesthetic result at the end. So this is an objective we reach every day. And the dental contact between the arches is also important. If we want to stabilize the aesthetic result, we must have a good contact between the upper and the lower class 1 occlusion, at least for the canine. And especially the contact between the upper and the lower arch must be very good on the anterior teeth. Tooth dimensions, sometimes we can reach a good result in some cases, but because we have a small laterals, at the end of the treatment, the result is not really very beautiful. So we must ask all the specialties to help us to correct the shape of the laterals. In this case, we must do a study and we must discuss with other specialties to improve the shape of the laterals. Tooth shape, we must also sometimes take our burrs and to reshape our teeth, especially some abnormal shape of the incisors. We must do some stripping to reshape the teeth. The characteristic of the surface with ortho, we cannot change it. So, like when we have the small laterals, in these cases we must ask some other specialties to improve the characteristic of the surface with veneers, for example, or with crowns, or with bleaching even. Tooth surface, this is our responsibility. When we debond our cases, we must be aware and we must take all our precaution to don't touch the enamel. So we must use some special tools and some special protocols to avoid to touch the enamel and to leave the enamel of the tooth surface as it was at the beginning of the treatment. Tooth colors, in our daily practice, we offer bleaching for all our patients because at the end of the treatment, because we use some special product, it affects the color of the teeth. So we can improve the smile, aesthetic of the smile by changing also the color of the teeth. This is an example before and after. Even if the teeth are well aligned at the beginning, on the left side, you have not a good color. So after bleaching, we could have a good aspect of the teeth. Dental edges. This is we do it regularly in all our patients, young patient and adult patient. We must reshape the edges from the second premolar to second premolar to have an impact on aesthetic of the smile. This is a patient I showed before and after, and not only aligning the teeth give us this result, but also reshaping the edges. We reshape the edges with this burr. And finally, the smile line. The smile line can be improved or can be very aesthetic if we position the bracket in the right position. And at the end of the treatment, we must have a smile line of the teeth, the anterior teeth, with the smile line must be at the same level with the smile of the lower lip. The smile line of the anterior teeth must be at the same level of the smile line of the lower lip. And at the end, smile is also affected with asymmetries. And at the end of the treatment, we must have an asymmetrical smile. A symmetrical smile, this can be improved by repositioning the jaws and also by repositioning the teeth. The midline must be on the midline of the face. So thank you very much again. Thank you to the organizer for this invitation, and hope to see you soon after this pandemic situation. Really, it's a bad situation for all of us. I would like to be with you physically, but unfortunately I couldn't travel to Saudi Arabia. Thank you very much again, and thank you for all our friends, and see you soon.